to have a little bit about why we saw a need to have activities merged together in the Nordic countries around evidence-based interventions under the heading of bridging the gap between research and practice. So what is this network all about? You could say that what we want to do is to provide an evidence base for improved health and social services, treatment, preventive and health promoting initiatives in the Nordic countries, and also broader if we think about the autonomous territories like Greenland, Faroe Islands and Åland Island. That was the beginning when we were thinking about that we have a lot of activities going on in the countries, and we also know rather much of some of the initiatives and the methods we have, but there are a lot of methods we don't know so much about. But it's not very useful that we do evaluations, look at the evidence base we have separately in all countries. We can learn from each other regarding procedures, but also on what have been already evaluated, for instance, in another country, what research has been conducted, and so on. So we can collect the evidence we have. We also have as an aim to better communicate what we actually know and also maybe what we don't know, because that is also very much so. So we know that in some areas we have a lot of activities, but we don't have so much evidence about what we do. And in other areas, we might have found out that we have evidence how to work with a certain problem, for instance, but we have a problem that it's not used. It's not finding the way out to the practices or policymakers, and we are, as researchers, of course, and working in between research and practice, we are frustrated to see that happening all over again. And we also understand that not everybody should or can read research and have time to go through everything. So we think that it's important for those who have the skills to read research to also synthesize and to present it in a way that is useful and understandable for those who work, for instance, with children in child health care or in daycare, and also those who make decisions about taking in such programs in municipalities, for instance. So you could say that we are all together working to provide support to our national databases. We all have our own systems and we have our own countries to serve, so that we can share knowledge that we produce as portals in our country, but also so that we can take in understanding and new knowledge from the other countries as well. That part is where we can share the knowledge of what we know. It's not only to synthesize the evidence of specific interventions, even if that is where this network has started, but it's also to support the implementation of effective interventions. So it's also about, for instance, what you know about interventions carried out. Are they used? Are there risks that they start to become blurred and not used in the right way? What could you do in order to get interventions actually to find out to those population groups that you would like to target? And what can you do if you don't find those ways? Last year, as I told, we were meeting in Stockholm, and we were discussing, for instance, that we have some interventions that works in a certain population group, but for instance, if you go out to groups who has been immigrants, for instance, you have to think about how to implement the intervention without losing the evidence. So this is where all started. And I don't actually know, Monica can say if I think Norway was the most active part here, taking initiative, starting to do evaluations for interventions. And here we can see a meeting where was the first time we were part of this network in Copenhagen on the left-hand side. And at that time, we didn't have kasvun tuki yet, but we had ideas about it. And I always remember that one of our board members, Miriam Kalland, who also is visible here in the picture, said that she had the feeling that Finland was like this small town football team in the Champions League. That was the feeling we had. But so I would like to say that without this support we have had over years, we wouldn't be where we are today with the portal we have in Finland. And here on the right hand side, you can then see that inspired of this meeting, we then the same year we had a meeting in Finland where we had Nordic collaboration. We also had people from municipalities in Finland, so that we wanted to have the understanding of how to evaluate interventions, but also to carry out them, as I said, so that they are understandable in real world practices. And we were Nordic, but we also had some Dutch inspiration. Gert van der Berg from the Netherlands Youth Institute was involved, and I wanted to mention that because we have Helen here today, and I would like to see that we have had a connection all from the beginning, also in the evaluation practices, which I think actually that our standards are quite much inspired of a Dutch example. So today we are 4 internet sources from 4 Nordic countries. From Sweden we have Metodguiden, from Norway we have Ungsin, we have Vidensportalen in Denmark, and kasvun tuki in Finland. Our mother institutions are a bit different. Metodguiden and Vidensportalen are in the Socialstyrelsen in Denmark and Sweden. Ungsin is in a university context, and kasvun tuki is you could say an independent foundation, but we are under the auspice of the Finnish parliament, so we have a connection, of course, to the governmental level as well. So this is what NordicDataPrev is about. And as you can see here, we have members that are today with us, and we don't have a portal in Iceland or in the independent regions, but during the Norwegian presidency in 2019, there was a report done about this network, and there we also had some inspiration and sharing with these regions as well. But please, Monica, now I would like you to say a little bit about the networks and what we have discussed so far. Thank you.
Yes, thank you. Well, there are, as you probably understand by now, 4 different databases. And I'll give you a very quick review of them. But of course, it's not fair because there's much more information. But hopefully you will be a little bit intrigued and can go back and look them up after the seminar. And then I will end with talking a little bit about the things that we think that we have done so far and possible future things we can collaborate on. I think, as Petra mentioned, we are all the different portals, they are there are many differences, but we stand a little bit between both the practice field. We address practitioners, but also we work closely with decision makers and more the policy level. This first slide here is from Sweden, Metodguiden, which provides an overview of interventions and tests within the social area. So it's not just for children and young people, but also for children. You can search in this and you can find information about the target group, the purpose, how the intervention should be used. And also it's presented if there are systematic reviews or meta-analysis summarizing the information about the effectiveness of the interventions, that you can also find it there. So that is the Swedish Metodguiden. It doesn't provide an overall rating of each intervention as some of the databases do. Okay, we can proceed to Denmark. No, we can do Norway first on the way over. That's good. We started out as a database, but we have transferred it into an online journal because we found that to be more attractive for the researchers, that they could publish articles. And every article is sort of standardized and presents a review of one specific intervention. It can be both treatment, but it can also be different types of prevention. And to summarize, to make it really easy to read, we summarize the evidence level on a scale from 0, which means it's ineffective, to 5, where we have a really strong evidence that the intervention works as it should and produces the effects that was intended. And every article is actually quite long, but you can read the abstract and the summary, and that's also available in English. So that will give you a quick overview. But we provide a description of the intervention, background, target group, how it should be used, the theory behind it. And then we assess different types of quality, including how the intervention is implemented. But of course, in the core of all of this, it's the effectiveness studies. So the conclusion on every article is that we try to say something about the evidence level on a scale that is how if this intervention is implemented in regular practice in Norway, how likely is it that it will actually work as intended? Yeah, so that was Norway. And then we have Vidensportalen in Denmark. And it is a bit broader in terms of the scope. And it presents overview of areas that can be, for instance, children of mentally ill. And then it has can have a little bit background information, risk factors, but of course also available interventions and what kind of literature supports it, etc. And they also include it not only children and young people, so it's a bit broader in terms of age group. And they have more than 180 interventions at the moment presented. So you can, it doesn't summarize in a scale from 1 to 5 in terms of the effectiveness, but it presents, it has a spider web that summarizes the findings on different types of areas, including the effectiveness of each intervention. Okay. And then we have Kasvuntuki, which has a focus on children and young people. And it started in 2013 and were inspired by both Ungsin and also the Dutch database, which was an inspiration to Ungsin many years ago when we started. And there's also a rating of interventions and a very comprehensive review of all the evidence for every intervention. And you end up with a level in terms of where the quality of the research evidence is taken into account, the level of effects, and practical usefulness. And they're also thinking about becoming a journal, so that is work in progress. Yes, and we have an overview picture of the different countries. Just to summarize, Norway and Finland, they end up with a rating system in terms of the evidence, and they also have a focus on children and young people. Sweden and Denmark have a broader target group, or they summarize evidence also for older human beings. Sweden doesn't offer a classification system, but they summarize and present the findings from systematic reviews. And Denmark, you can get information that is a little bit broader outside just a focus on interventions, but also more about problem areas. And the spider web sort of summarizes how much we know about the of the effort, and effect is one of the things, but also other aspects that that's evaluated. So there are some similarities and some differences, but I think we've learned when we meet and discuss, there are many common themes that is interesting to discuss, and one of the things that we have discussed so far are, of course, standards and criteria for looking at interventions and evaluating them. How should we rate methodological quality when we look at studies that have been conducted? Descriptions of the intervention and implementation problems. Of course, all of us have a focus on interventions that exist in the Nordic countries, but it's not always easy, because sometimes when interventions are imported, they can change a little bit. Sometimes they keep the name, but they change the content. So it can be really hard to, quite some detective work that needs to take place to find out if we are looking at the same thing and discussing the same thing. We've discussed evaluation procedures and outcomes and what kind of literature we should search for. So there are many different aspects that we've touched upon in over the years. And we also met in Copenhagen, and in hindsight, I think it was 2018. Mm-hmm. When I inspected my photos from Tivoli in the evening. It was 2018. But there we joined, and it was a combination with an implementation conference. And some of the things we looked at there was, would it be possible to look at the databases collectively, to have some sort of search functions that so that professionals working in the Nordic country could access information from all of them? That was one thing. Would it be possible? We haven't sort of, that's still work in progress. That's not something that's available at the moment, and probably we're a bit different, so it won't be very easy to do it, but it's certainly something we can look at. Also, we discussed having a common evaluation pool of people reviewing the interventions, because there are not that many researchers available in every country. So wouldn't it be nice if we could use all of them a little bit more flexibly, and also compiling evidence on interventions used in many of the Nordic countries? And one project that has made the two last items a little bit possible is a project that was initiated from Iceland, and as Iceland being the host of the Nordic Council, and it's called 1,000 First Days, and it starts with pregnancy and proceeds until the child is 2 years of age. And instead of, well, sometimes we use quite a long time when we review a single intervention. In Ungsyn, we can sometimes spend up to a year in one intervention. So we decided, can we work a little bit faster and do 100 interventions in 1 year instead? So that is actually, we're trying to do a speed evaluation where we have around 65 different interventions for this target group, and we also have measurement instruments. So altogether, it's almost 100 interventions and tests. And then we're using a pool of researchers in Norway and Finland that are trying to do their best in terms of collaborating while the corona is doing its taking its toll on all of us. And we are sort of halfway through the list of all these 100 tests and interventions, and I think it's been really interesting and fun to work together in this way. And I think it also has a little bit potential, because sometimes politicians and decision makers want answers quickly, and they don't want to wait in months and years. So providing them with information that they can use for making decisions in a very speedy manner, it's I think it's very interesting, and hopefully it will be something that will be used and certainly available to all the Nordic countries. So the last point is also something we discussed in Copenhagen was that is it possible, when we are done with the main bulk of interventions in every country, to summarize the evidence for let's say certain target groups, let's say young adolescents or with anxiety, depressive problems, or certain problem areas that we can focus on, children who are mentally ill, for instance. So that's all something that we will continue to discuss in the years to come, how we can summarize what we have learned so far in a little bit different way, so that it can be used in terms of target groups and areas. Thank you so much.